Your heart fills with love as you watch your baby sleep. They look so peaceful, so innocent. But as every new parent knows, getting your baby to sleep through the night can be a challenge. Sleepless nights and irregular naps can make those early months feel overwhelming. Don't worry. You can help your baby develop healthy sleep habits. Today, we'll walk you through steps to create a smooth sleep routine for your little one, so you can both get the rest you need. Baby's sleep needs, 0 to 6 months. In the first 2 months of life, your baby's need to eat is greater than their need to sleep. Breastfed babies may need feeding every 2 hours, while bottle-fed babies might last a little longer. Newborns can sleep anywhere from 10 to 18 hours a day, often in short naps lasting 3 to 4 hours. Babies don't understand the difference between day and night, which means your little one may be wide awake at 1 a.m. and asleep in the middle of the day. By 3 to 6 months, many babies start sleeping for longer stretches, around 6 hours at a time. But just when you think you've got a routine, growth spurts or milestones like crawling can disrupt their sleep. Establishing a bedtime routine, 6 to 9 months, a consistent bedtime routine can be a game changer. Research has shown that babies who follow a nightly routine fall asleep faster and wake less frequently at night. Start your baby's routine as early as 6 weeks old. The key is consistency. Play active games during the day, but make the evening routine quiet and peaceful. Stick to the same activities in the same order every night. Many babies enjoy a calming bath right before bedtime. Keep the bedroom environment calm and consistent. If your baby wakes up during the night, the room should look and sound the same as when they first went to sleep. Teaching your baby to self-soothe, 6 to 12 weeks. Once your baby is 6 to 12 weeks old, you can start teaching them to self-soothe. Instead of rocking or cuddling them to sleep, lay your baby down when they're drowsy but still awake. This helps them learn to fall asleep on their own. If your baby struggles to settle, try moving bedtime earlier rather than later. An overtired baby often finds it harder to sleep. Sleep safety first. Lowering SIDS risk. Safety comes first when it comes to sleep. The American Academy of Pediatrics has several recommendations to reduce the risk of sudden infant death syndrome, or SIDS. Always place your baby on their back to sleep. Use a firm sleep surface without loose bedding, pillows, or stuffed animals. Keep your baby in the same room as you, but not in the same bed. Offer a pacifier, but avoid devices marketed to reduce SIDS, such as positioners or wedges. Finally, make sure your baby gets all recommended vaccinations and some daily tummy time when awake. Breastfeeding, avoiding smoking, and maintaining a cool, comfortable environment can also significantly reduce the risk. Cry it out. Should you or shouldn't you? The cry it out method is a widely discussed sleep training technique. One of the most popular versions is the Ferber method, named after Dr. Richard Ferber. The idea behind this method is to teach your baby how to fall asleep on their own and soothe themselves if they wake up during the night. Here's how it works. You put your baby to bed while they are drowsy but still awake. If they cry, you wait a few minutes before going back in to check on them. Comfort them with your voice, but don't pick them up or stay for more than a couple of minutes. Each time your baby cries, you wait a little longer before checking on them again. This helps them learn to settle on their own. Start with shorter intervals on the first night, gradually increasing the time over the next few nights. The first few nights will be hard, but most parents see significant improvements by the third or fourth night. Within a week, many babies can sleep through the night. Alternatives to the cry it out method. If the cry it out method feels too stressful for you or your baby, there are alternatives. Some parents prefer gentler methods, such as bedtime fading or no tears approaches. These methods allow for more gradual adjustments while still helping your baby learn healthy sleep habits. Remember, every baby is different. What works for one may not work for another. Be patient with yourself and your little one as you find the best approach to fit your family's needs. Helping your baby sleep through the night isn't just about getting them to close their eyes. It's about creating a safe, soothing environment, establishing a consistent routine, and teaching them how to fall asleep on their own. With time, patience, and love, both you and your baby will find the peaceful rest you need.